Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
There, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. And yourself?
Living it up.
Yay. I love that answer. We're going to make sure that our listeners live it up today, too. You want to know why? Because they're in chronic musculoskeletal pain. And today, when they call and talk to you, they might find a way out of their pain. So what kind of pain are we talking about? We mean muscle pain, joint pain, tendon pain, disc pain, back pain, ligament pain, knee pain, hip pain, neck pain. Perhaps you have stiff joints, dull aches that you can't explain. You're not sure what the pain is. And that's the purpose of our show, to help you, title of the show, live pain-free. So Dr. Darrow's ready to take your calls. I have lines open for you at 866-870-5752. That's 866-870-5752. That's our number here at the station. And when you phone the program today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies. The foreword is written by the wonderful Suzanne Summers, and there's great information in this book, so you really want to get that today. So do give us a call at 866-870-5752. That's our number right here in the studio. And check out Dr. Darrow's website at www.lastemcells.com. That's www.lastemcells.com. We are here Saturdays at 10 a.m. and again at 1 p.m. And if you're listening at an off time, you can call the office for more information at 800-300-9300. That's 24/7, this number. Call anytime at 800-300-9300. And do go to the website. You can email Dr. Darrow off of every page on that site and watch him performing the treatments on videos. So
yes, I do have a question sitting here.
I knew this. Go for it.
Anytime someone wants to reach me, they can go to my website, which Nita just mentioned, which is www.lastemcells.com. And on the website, every page has a place to send me an email. I get emails all day, all night. And this is an interesting one that came in. It says multiple area treatments. So the person says, I have multiple areas that need help. I had rotator cuff repair twice on my right shoulder. Now they say the next step is a reverse shoulder replacement. So I'll read the rest of this, then we'll go back one by one.
Okay.
Left shoulder actually hurts more than right, and doctor says, go right to a reverse replacement. Well, I'm not in favor of any of that stuff. Then the person says, I have arthritis in my hips and my knees. And then, to top it off...
Oh, no, there's more?
And then the poor person, God bless you, said, I had back surgery last year and still have nerve damage. Can stem cell or PRP help with all these? And is there any limit as to how much can be used? So I'm going to start there. Stem cells and PRP. PRP is platelet-rich plasma. Simple procedure of drawing your blood from your arm, spinning it in a centrifuge, and then throwing away the red cells because they hurt, and just using the platelets and injecting those anywhere in the body we like for musculoskeletal pain. All right, so don't email me about all kinds of diseases that you might have. diabetes, eye problems, things like that. I don't do that. I just do orthopedics, musculoskeletal pain, which is limited to the joints, ligaments, tendons, neck pain, back pain, arthritis, things like that. The good news is I can do it anywhere from the back of the head for people that have headaches to the neck, the spine, anywhere. And then we can get to the shoulders, and we can get to the elbows, the wrists, the fingers, and into the low back, and also the hips, the knees, ankles, feet, toes. So quite a bit of territory that I've injected over my career, which is now spanning, been doing this work about 22 years. And I started during my residency at UCLA in physical medicine and rehabilitation. And I started out in training in orthopedic surgery. And then I had one on my shoulder, and it came out bad. And I jumped ship and learned how to do regenerative medicine. And after my failed shoulder surgery done by my professor, who I loved, it just didn't work out the way that we wanted to. It made it much worse. I was able to heal my own shoulder by just injecting it, and about 12 hours later, it was 100% completely cured. It was a miracle for me. And then I learned that doing these injections can heal most areas of the body. So don't come to me if you want surgery. I'm going to talk you out of it. Some people get mad at me. They go, well, there's no guarantees. Well, there's no guarantees in surgery. We're just talking about a guy who had, reverse, or the next step is reverse shoulder replacement. He already had 2 rotator cuff repairs, that's in the shoulder. They failed. And then on his other shoulder, they want to do a reverse shoulder replacement. Now, personally, I think that's insanity. But we all have our tools that we use. And, if you go to a surgeon, most likely you get surgery. If you go to me, most likely you get injections. What are these injections? We use cells from your body, platelets, stem cells, and we inject them into areas that are worn down, torn, or arthritic, things of that nature. Doesn't heal everything, and the failures are generally because people don't complete the treatment plan. I just got a terrible yelp from a guy who had one treatment on his knee, and he had pretty bad arthritis in his knees. I'm not going to go into it because it might be considered a HIPAA violation, but some people don't listen to me, and that's just the way it is. You've got to listen to how we help heal, and if you don't know what Yelp is, Y-E-L-P, you can go to mine, just yelp.com, and put my name in, Marc Darrow, M.D., and you'll see all the Yelps I have. I think there's about, active ones are about 175 or so, and you'll see mostly good ones. Once in a while you'll see some bad ones. There's no guarantees to this stuff, and there's no guarantees to anything in life. But if you listen to what I tell you, you'll probably get good results. The other reason, beside people not completing the program, is they don't listen about their activities. Some people go out and do their sports the same day or the next day, and then they come back and say it didn't work. And I say, well, you didn't work it. You got to listen to what I tell you, and you got to let it heal. So those are things that go part and part, hand in hand, with the healing process. Let it heal. If you get surgery, you don't go out and do sports right afterwards. So most shoulders we can get better. Some we cannot. And I'll usually tell you up front, it usually takes me a minute to touch the area. I don't really care what your MRI or X-rays show. I like to get them to be safe. So what was the next thing? Here the person says, I have bad arthritis in my hips and knees. Same thing. We can usually help you with those. Now in the shoulders, the hips, and the knees, we absolutely have to use a diagnostic ultrasound. We need to put a probe on the joint and where the problem is, take a look and see what is going on. When we inject, we have to use that ultrasound to guide the needle. If you're getting injections from someone who doesn't use an ultrasound, that solution that they're putting in to the joint doesn't get there in most cases. And it's kind of a joke that we regenerative medicine docs have, because years and years ago, when we did hips, they didn't heal well. We didn't understand it. We had better luck with shoulders and knees and other parts of the body, but the hips were a problem. Then when ultrasounds came out and we started using that, and we saw how teeny that joint is, we started getting great results. So go to a doc that uses an ultrasound to get into the area. This is not the kind of ultrasound that's used to heat up the area. This is an ultrasound that's like a camera, and you can actually look into the area that you're injecting and look at the needle. You can actually see it, and you can see the solution go into the area that you want it to. So this person also said, going on terribly, unfortunately. They had back surgery last year, and they're worse. Still have nerve damage. Well, I'm not a proponent of back surgery. I'm sorry. Don't kill the messenger, but we get most people better without surgery. And here's another question that the person had. Can stem cell or PRP help with all of these? Probably yes. I have to touch the area to see where the pain is being generated from. And is there any limit as to how much can be used? Not really. I've had people fly in from other countries and we do their entire body at one time. I know that seems excessive, but there are some people that want to live forever and they are being proactive, which means they're injecting areas that don't even bother them at the time. So there's basically no limit as to how many areas that can be done at one time, although we don't generally do that. People usually come in for 1 or 2 areas, maybe 3 areas, and we can do that all at one time. So there's good hope for all of you that have musculoskeletal pain. You need to come into the office. My office number, by the way, if you want more direct information than we're giving you on the radio show, is 800-300-9300. I'll repeat it while you run and get your pens or pencils. That's 800-300-9300. And if you want to talk to me live right here on the radio, call me up right now. The radio show number is 866-870-5752 at KRLA. I'll repeat it for you. That's 866-870-5752. Would love to hear you right now. Love to get some questions going. While we're waiting for callers, we have a lot more questions that I can go to, but I want to give Nita something to talk about, so I know you always have things to say, Nita. I've got a couple more before we get to you.
Okay.
One of them is we do the vampire facelift. I know that Halloween is coming up. It's a great name. It was patented or trademarked by a doctor down in, I think, Alabama or somewhere down in the south. And it's a great name. The vampire facelift is using your blood. We can also use stem cells and the platelets mixed together to, in essence, plump up the collagen in the face. And really all we're doing with these injections that I do on the body is we're regenerating new collagen, which is the major constituent in the joints in cartilage. But it works great on the face because the face, as we age, starts to dry out like the rest of the body, and we get a little gaunt looking. So the injections on the face work real quick. Usually by the next day the person looks a lot better and is ready to go to their party or whatever it is. And also we do this on the top of the head for hair regrowth. And if you go to my book, which is Stem Cell and Platelet Therapy, in the back there's a chapter on hair regeneration, and I think on the vampire facelift also. So these treatments can be done basically anywhere in the body to help regenerate and rejuvenate the body. I do mainly the musculoskeletal system. My wife Michelle does most of the cosmetic work, and she does with that, you can mix it with fillers if you want to, and sometimes she'll do Botox. She's a great artist. If you go to the website www.lastemcells.com and you look at the treatments, you'll see videos of her doing face and hair, and you'll see also on the menu, you'll see videos of me doing different parts of the body, and see if this is something you think is for you. Nita, your turn if you got something to say. Otherwise, I'll go to a question.
I do. I want to remind people they can call you and speak right now. We have lines open at 866-870-5752. That's 866-870-5752 right here in the studio. And you get a free book. It's called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. And if you want to know exactly what that means, you should call in. Again, the number is 866-870-5752. You're on.
So I am on and ready to rock. Do you remember Dr. Gene? He was my radio host a long time ago. He was so fun. He used to say, "We're here live and local." Dr. Gene, if you're listening, as you probably are, God bless you, man. He's a great guy. So another question that's come in is called stem cell therapy. Let's see what this person is asking. I'm interested in stem cell treatment, but I am told by multiple medical people that it doesn't work. Please advise. Well, I've been one of the first people who has done stem cell therapy, and it's probably been for about 10 years now. Prior to stem cells, I used platelets. And prior to platelets are cells in the blood that have healing techniques that are attached to them. They have growth factors, they have cytokines. Stem cells have similar things. If we take your bone marrow, that has platelets and stem cells in it, and some of the other healing things too. So in my experience, stem cells mixed with platelets are the best treatment. We get that from bone marrow, but there are other ways to do that too. And prior to all of that, going back 20 plus years, I used to use sugar water. And you'd think, how can sugar water heal the body? It's what we call an osmotic shock agent, and the term for it back in the day was prolotherapy. Prolo meaning it's a Greek term for stimulate or proliferate tissue. So wherever we would inject the sugar water, we would get cell death. A superficial layer of cells would die, not enough to hurt the person, but it would get inflamed. And inflammation is one of the ways the body heals itself. If you sprain an ankle, it gets inflamed, and then fibroblasts, which are cells that grow collagen, are brought to the area, and new tissue is grown. So that's something that I did on thousands and thousands of patients. I did it on myself. The first area I did it on was my right wrist after a golfing injury where I hit the ground instead of the ball. And I was miserable. After one injection, the very next day I was about 50% better. I then injected my wrist about 4 or 5 more times with the sugar water, and it was completely healed. And actually I'm going to go play golf today, and pain-free, I might say. I have had other injuries to my body. I've had, beside my right wrist, both my elbows, from weightlifting and playing golf, both my shoulders from different sports, tennis, golf, weightlifting. I've had neck and back pain, which also I've used these techniques on. And my knees also, I've done both my knees. So I'm sort of a walking testament, a walking miracle to regenerative medicine. First in the old days using prolotherapy, and then as time went on, using platelets, PRP, and then stem cells. Now when I inject myself, I always use stem cells. It's the most advanced treatment we have, but the others are still good. I'm not going to put any of them down. I've also used things like sodium moruate and zinc sulfate and some other things back in the day. But what I find now is that the platelets and the stem cells seem to be the easiest way to heal things and the quickest. We do have people come in for the old-style prolotherapy, the dextrose, and I try to talk them out of it. There are certain doctors that only use that because they believe in it and they've been doing it so long. But my own personal experience, and that was on my left knee years ago, my wonderful dog Dakota, he's an 80-pound husky. I love huskies. I've got Dakota and Bella now, 2 huskies. They're outside playing together right now. And he hit me full speed at the dog park and hit the outside of my knee. And it was such a big hit. It hurt on the inside of my knee, not on the outside. And I had a meniscal tear, and my ACL, that's the anterior cruciate ligament, was stretched out, and my the medial collateral ligament was stretched out. So it could have been worse. Dakota, I still love you, don't worry. And he was just going so fast. There is a trick, by the way. When you're at the dog park, make sure your knees are bent, because there are so many dogs around, you can get hit like I did. My knees were not bent. I was standing straight up, and it didn't take the shock very well. So I had terrible knee pain, and there were times when I couldn't straighten my knee. It would get stuck. The patella was out of its track, called the trochlear groove. And I did dextrose prolotherapy on it about 10 times or so, and it would help. It would help tighten it up. But then when I'd go running, it would loosen up again, and I would have the same problem. So I finally used PRP, and in 1 day and a half, it was stiff overnight, and then I was able to go out running, and pain-free, no more locking. I did it one more time about a week later, and I chilled for a little bit to let it heal up, and that knee has never once again caused me a problem. So the more advanced treatments work better. They all work to some extent, but as long as you're going to get injections, my point of view is why not do something that's the most efficacious with the least number of treatments. I'm going to give out the number to call me right now.
Okay.
I'd love to talk to you. So jot this down. Go run and get a pencil and paper. The number to the studio is 866-870-5752. That's 866-870-5752. We would love to hear from you. And if you miss this live show and you get on a recorded show, which happens occasionally when the studio has a blank spot, sometimes they put my shows in there. So if you want to call the office, you could call right now and talk to someone. And the phone number to the office is 800-300-9300. Great number, 800-300-9300 if you have more specific questions.
Sounds
Shall
good.
I take another question, or do you have something you would like to talk about, Nina?
Well, I just want to let people know here at the studio that number, again, is 866-870-5752, and we have lines open.
Let me go to another question here that just came in. It says, husband's knees, and this is kind of funny because a lot of people that come in have a spouse that's dragging them in. And it is funny.
That's funny because who wants to be in pain?
Well, what happens is it's usually the spouse that can't stand hearing the other spouse complain. We're going to go to a break. Please give us a call, and we'll talk to you right after the break at 866-870-5752. We're live and local.
We are live and local, and this is Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.